Yeah, that's the great way to look at the strategic supply chain. Let's take some API, small molecule, drug substance, and intermediate thing. If we want to relocate all the outsourcing needs as part of Biosecure Act, we need to compensate 200,000 to 300,000 metric tons of material to be moved into US, which is a gigantic amount. And if you see the statistics for a larger pharmaceutical company, there is 20,000 to 30,000 metric tons is the capability in a year. So it's a 10 folds, which will take 4 to 7 years with all regulatory hurdles and all the quality and FDA inspections. So the best thing is to act strategically. Uh, and the question comes like, if I'm a small biotech and I'm getting the federal funding or NIH, do I need to what kind of strategy I should adopt? So my point of view on that is keep continuing doing the stuff with the films that you are already working on, and build a strategy, build your tech transfer team, talk to your legal consultants, talk to your experts. So build your scrutiny, what kind of scrutiny they are going to do, so that all the things will be in the place for the stage one. In the stage two, my ideology is to talk to the supply chain diversification and build the technical talent with respect to the technology transfers. So once any biotech, as I mentioned earlier, the quality, time, and the material availability are important. If you secure those things in the first attempt, in the preclinical phase one stage, so you have that talent. Because why I'm talking about the talent here, there were more than 20,000 scientists that are working on the outsourcing part, compensating this much gigantic amount of outsourcing activities for the biotech. So you need to build the talent development as well as the outsourcing needs together. So, in the nutshell, the supply chain diversification comes in two categories. One is stick where you are working on, and the second phase is lay out strategically your supply chain checklist. What kind of evaluation you need to do, what kind of cost, what kind of budget you need to put into your annual budgeting thing. These are the stepwise process you should consider when you are planning strategically.
Yeah.
The most important thing is moving to the CDMO. The last part I want to add on the CDMO part. Even CDMOs and big pharmaceuticals are not an exception for this. If a biotech company going to the another CDMO, the CDMO is heavily rely on the Chinese or the other Biosecure Act concerning firms because of the cost and the productivity part. So we need to get the checklist done. What is the alternate CDMO strategy that they are going to adopt in taking your product into their consideration?